bringing life into the world can be one of the most joyous occasions some women experience. But the truth of the matter is every woman is different, and some women require special attention during and even after pregnancy.
That's right, and you can never be too prepared when that special time comes. Back in the studio with us today to discuss what moms should expect during labor and delivery is Dr. Stephanie Hack. And Dr. Hack, it is always a pleasure to be with you today.
It's great to be back.
So let's just jump right into it. So when a mom is pregnant and has her child and she goes to the hospital, what is the first thing she can expect from the care team for both the baby and the mom?
Sure. The first thing that she can expect is to be greeted with respect to her privacy, to whatever she's experiencing. And someone will be there to ask her very first why she is coming in. Because what we really want to figure out is how emergent is the situation right now.
Yeah. So tell us a little bit about the difference between early labor and false labor. What are the differences and how can someone tell if they're in one or the other?
Sure. Early labor is contractions. So when you start having contractions, you think that you're in labor. Let's start there. But when you're in early labor, your contractions are doing something for you. They're going to be softening your cervix. They're going to be making your cervix shorter. They're going to get your cervix to start dilating to lead you into active labor. Whereas false labor, contractions that aren't really going to lead to any kind of cervical change, they're not going to lead to any cervical change. And honestly, it's really hard to kind of figure out the difference. One thing could be more regular contractions. If they're more frequent, that's a sign that you might be entering early labor. And ultimately, you'd need an exam, a cervical exam, to determine if your cervix is changing or not.
And when the mom is in the hospital room, talk about some of the choices they can make as far as pain relief, who should be in the room, and also the importance of them speaking up and advocating for themselves if they just feel something's not right.
There are so many choices, and I'm so happy that you asked that, because that's the primary thing that makes women feel unsafe when you go enter an environment and feel like you don't have an option. So all of the hospital's policies will be different, but generally speaking, you're allowed to have some number of visitors, whether that's going to be family or friends, whoever you want on labor and delivery supporting you. And then as far as pain options are concerned, things like an epidural or a spinal anesthesia would be if you have a C-section, but you have the option to decide if you want an epidural. There are also some medications, sometimes they can give you some morphine or something in your IV to make you a little more comfortable if you're not yet ready to have an epidural. Sometimes they have a gas called nitrous oxide that's going to also be hospital specific to make women more comfortable. So there are a lot of different options as far as pain control is concerned. And then regards to your question about the advocacy, that is why it's very important that you're selective about who is going to be there with you, because you want the people who are on the same page as you and who can vocalize your concerns when you're not able to.
Yeah, and as in terms of advocacy, I know some people opt in for like doulas or midwives. Is that an option that women can advocate for themselves to get that from the hospital?
So the hospitals don't generally provide doulas, but women often have doulas that they have a relationship with before they go to the hospital. And that is definitely something, a great resource for anybody who feels, honestly, I'd say for anybody, because having a doula is so beneficial in so many ways as far as labor is concerned, but then also having somebody who can kind of talk you through it in addition to your team, because your OBGYN, your nurse, they might not be able to be with you the whole time. They're caring for other patients, but your doula is just for you.
And obviously when you're a new mom or even a new dad and you're in that hospital room, it can be scary, especially for that mom. What are some things you would say to that, what are some things you would say to the mom so they can ask the doctors?
I would say first, the primary goal is to have a team. And some people bring birth plans. Not everybody does, but I think a birth plan is a great way to start because it kind of demystifies some of those things that you might experience on labor and delivery and gets you in conversation with your OB before you even go into the hospital. And it makes it kind of easier to bring up your concerns at the very beginning of the visit. But what I really want to emphasize is they are your team, your nurse, your OBGYN, and they are there to keep you safe. Their goal is a healthy baby, a healthy delivery. Their purpose is to support you. And if you don't feel like you're being supported, you can always escalate, because there's a chain of command. If one person isn't helping you, then you have the ability to escalate and ask the next person. You can ask the charge nurse. If you're not getting help from your nurse, you can ask the nursing supervisor. There is a chair of OBGYN at the hospital, so you can continue to escalate your concerns.
Gotcha. Dr. Hack, thanks so much for coming in. We really appreciate your time.
Thanks for having me.
All right, for more information on women's health and Dr. Hack's podcast, visit ladypartsdoctor.com.